Hi, I'm Matt Mackey. I'm a fourth-year medical student at Dartmouth, and I'm here to tell you how to rock your psychiatry clerkship, specifically dealing with difficult or aggressive patients. The first thing to know always is just that if you're ever scared, you're in the room with the patient, you can get help. You know, stay by the doorway, don't let yourself be in a position where you can get trapped. Security is usually pretty close by on hand when those sorts of patients are around, so don't ever feel like you need to be the hero and be gung ho and go stay in there with an aggressive patient that's getting riled up. Usually it's just better to back off, let them calm down, and go get some reinforcements. Two, work your empathy muscles. These patients are just looking for an excuse to get worked up, and the more you can just kind of diffuse that tension a little bit, just give them some, oh, that sounds really difficult. Sometimes they'll get a little riled up with that, but it might be like a cathartic riled up, yeah, I am having a hard time, and they'll take a little breather and just kind of get it off their chest, so to speak. The other thing is just not to bargain with these patients. A lot of the times patients who are getting aggressive, they have some kind of agenda. Maybe they want to be admitted and they figure if they cause a fuss they'll get admitted, or maybe they don't want to be admitted and they figure they'll kick me out if I get all worked up. With patients in general in psychiatry, don't ever promise anything you can't keep. Really just try not to make any promises at all is the safest way. If you ever tell a patient oh, we're pretty definitely going to commit you, and then you go talk to your attendant and they go, oh no, that person, we can't take them, and you send them out in the street, the patient can get pretty frustrated. So be wary of doing that, especially with patients who are prone to getting riled up. When you're taking the history, it's important to focus on just get the facts and get out. A lot of the time, patients can go on, they can go on tangents. If you're thinking about depression, really just do your SIGI caps, the various mnemonics you have, and just trying to work through rule in, rule out. Okay, they're not depressed. Okay, let's move on. Let's think about schizophrenia. Okay, are they seeing things? No. Okay, keep things moving in that regard. A lot of focused history taking can help there. And last thing is just to stay calm. Stay calm. All these patients really benefit from just being able to get things off their chest. Having an understanding conversation is the number one thing you can offer as a medical student. Is just being there, listening, showing some empathy, and if you get the history on the way as well, great. But that's really the best thing that you can offer in a lot of circumstances. Don't try and fix all their problems at once. A lot of other people have already tried. I guarantee you. Don't take all of it on yourself, or you'll explode. So, hope these quick tips help you rock the psych clerkship.